Hi, this is Dr. Michael Hyman from LA Circumcision. Today I wanted to talk about some of the pitfalls that are seen with circumcisions and why people have had problems. And perhaps these are things that you can talk about if you are meeting with a urologist and you want to ask questions about their experience and things to avoid. The first thing I'm going to talk about is a problem that occurs if the incisions of the circumcision result in a tethering effect of the shaft skin to the head skin. Okay, so when you do the circumcision, you're making two incisions. One is behind the head of the penis on the outside of the foreskin, and then you pull the foreskin all the way down and make a second circumferential incision just below the head. And you're bringing these two incisions together and basically removing a cuff of skin, okay? And so you end up with this cut edge on the shaft of the penis and a little skirt of skin that's hanging around, that you still have maintained behind the head of the penis, and you're bringing those two edges together. And what can happen is, and this is not, unfortunately not that unusual, is that the surgeon inadvertently made the incision too far back, too far below the head of the penis. That's the first incision, not the one with the skirt of skin, but the first incision is made too far down the shaft of the penis. And then what will happen is, if they don't leave enough skin on that skirt behind the head of the penis for the second incision, now you've got a gap between the shaft skin and the skirt of skin around behind the head of the penis. There's a gap there, and when you try to stitch those together, the skin will be kind of on stretch. And you can imagine that if you have an erection, that's going to be a problem. Over time, that can eventually, the skin does stretch, but obviously it's not a particularly pleasant process to go through. There's not a whole lot you can do if that has happened, except know that over the course of several months it should resolve. But it's really a tricky problem if it occurs. I even tell my patients sometimes, listen, you'd rather have a little extra foreskin than have too little. So if a tiny bit of foreskin is left so that it just starts to, fold slightly over the, behind the head of the penis, you'd rather have that kind of a situation than the other way around. The second thing that can happen that is not unusual is that you can get these marks, these kind of railroad track marks from the stitches themselves. And part of that happens because the surgeon's tying them too tight. The real technique here is just to reapproximate those skin edges, but not actually tie them so tightly that it cuts off the blood supply right where that stitch is. That can worsen the scarring. And the last thing to mention is something called the frenulum, which is on the underside of the penis. So just behind the opening where the urine comes out, there can be a little kind of a tethering skin band that's called the frenulum. And how that frenulum is dealt with can be kind of a sensitive issue, because if it's a very well formed frenulum and pulling back the foreskin is going to cause some tugging on that frenulum, it probably needs to be dealt with at the time of the circumcision. And there is a way in which we can make the incision in the frenulum sort of horizontally, but then when we actually stitch it back together, we actually put some of the stitches in vertically, kind of in the same direction of the shaft. And that can often result in reduced tension on that frenulum, so it's not tugging on the head of the penis. So these are just some tips that you might want to mention with your doctor. And if you have any questions, feel free to reach out on lacircumcision.com. I'm Dr. Hyman. Thank you.